I'm Dr. Russell Jennings, pediatric thoracic surgeon at the Esophageal, Airway, and Thoracic Division of Johns Hopkins All Children's Hospital in St. Petersburg, Florida. I'm here to talk today about straight spine syndrome. It's a very rare problem, but it can be quite severe and it can cause respiratory problems with compression of the trachea and even need for tracheostomy, which may not actually be effective. Let me teach you about straight spine syndrome and show you how we can treat that problem effectively and have treated it to success. Here we have a drawing of a chest. This is the Manubrium, which is the upper part of the sternum, and this is what's called the gladiolus, or the majority of the sternum, right here. And this is the xiphoid, which is the most bottom part of the sternum. On the back, we have the anterior longitudinal ligament of the spine right here, and this represents the front of the spinal column, and each of these square blocks is a vertebral body. The vertebral bodies are stacked on top of each other in such a fashion that makes your spine, or your bony spine. In blue, we have the trachea. The trachea consists of rings of cartilage which go 3/4 or 4/5 of the way around, keeping the trachea open as it is compressed a little bit anteriorly by the aorta. We can see here this represents the aorta, which is the major blood vessel that pumps all the blood to the body out of the heart right here. So this is the normal structure of the chest, where we have the spine, and in the back right here with the anterior spinal ligament, we have the heart in the middle, the aorta in the front, the trachea behind the aorta, and the sternum, which is in front. Now sometimes, either because of developmental problems or because of surgery, we'll have the Manubrium, which is once again right here, and the gladiolus, or the sternal body, which is right here in the front, and the xiphoid we can have right here. It will stay sort of in the same position, but the spine is straightened. It can either be straightened because that's how the person grew. It was genetically predisposition towards having the spine in a very straight fashion. It looks just like a straight line. So this would be what it would look like with the vertebral bodies stacked on top of each other, sort of in a straight fashion. There's not a lot of give. The problem is that basically this spine has moved forward for whatever reasons, and the trachea, which consists of rings right here, gets compressed. It can be compressed by the Manubrium, which can be angled posteriorly or towards the spine, as in this case, which is very common and usually of no consequence because it's so far away from the trachea. And the trachea can be compressed by the spine moving forward. Well, how does that occur? Well, it occurs because the aorta, which is right here, can't really be compressed. It's very strong structure. It's very tough. So that aorta stays its same size. The trachea is then compressed between the spine, which we see right here, the spine, which has been moved forward, and the gladiolus, or the sternum, which has not moved. It gets compressed. This can cause severe respiratory problems, made much worse simply by bending the head forward. By bending the head forward, the trachea will be further compressed when this spine moves forward like this and gets completely compressed in that little space between the Manubrium and the spine, just bending the head forward. So what are the solutions? Well, there's a couple of solutions. One solution is if the only problem is the Manubrium, which is angled posteriorly, is to simply take the Manubrium out. If we take the Manubrium out, then there's no compression. And that can be done, relatively small operation in the neck, we take it out, and the trachea, if that's the only part of the problem, will then open up, we may have to suspend the trachea by doing a little bit of work to bring it forward here with a couple of stitches. It's not terribly difficult and can be done relatively easily. In those cases, when we have straight spine syndrome with manubrium, the upper part of this of the sternum, which is compressing the trachea. In the cases when the aorta is compressed against the manubrium and the spine, and therefore the trachea is pancaked between the two, then we know how to fix that and have fixed it. And you can look at another video we've made on sternal expansion, on the expansion thoracoplasty. We can teach you how to do that. So this is the straight spine syndrome caused by compression of the spine, pushing everything forward against the sternum, which is not moving, causing the aorta to compress the trachea completely flat, or the manubrium, which is angled and compressing against the trachea, causing it to pinch closed. This is Dr. Russell Jennings, pediatric thoracic surgeon at Johns Hopkins All Children's Hospital.